So we do a lot of work with, the public health system. And one of the things that happens is that as new conditions are being considered for addition to the federal screening panels in the US, which is overseen by the Secretary of Health and Human Services, is that there's this health economic calculus that's made. So the evidentiary requirements include having to understand the urgency and severity of a disease, whether or not there is a valid and reliable screening test, whether or not there is an intervention that warrants the screen be added. But then there's also a consideration of how much does it cost to add the screen to the screening panel, and what's that impact on the state laboratories and the providers. But what's always missing is what's the cost to not screen. And there isn't data ever provided around that. We just don't have that data. And so it was really important to us to start to provide that data to say whether or not we're screening, babies are being born with these conditions. But the introduction of screening technologies, whether we're talking about the metabolic panels that are traditionally being used now, or some of the next gen sequencing opportunities that are before us, there are avoidable costs that are existing in our system. And if we don't invest in those technologies that we have today, we are still paying for it. We cannot afford not to do it, because what we have today also available are potentially life-altering and life-saving therapeutics and interventions that are being delayed and not being offered to individuals, babies, children, adults, during the optimal therapeutic windows, because we're not being identified until it's too late to optimize outcomes. And so I think this data is really important to get in front of the people that need the justification to do what we're trying to do.